Hello, I'm William Zoghbi. I'm the chair of Department of Cardiology here at Houston Methodist Hospital, and it's a pleasure to have with us today Dr. Harlan Krumholz, professor of medicine at Yale, and also director of the Outcomes Research Center at Yale. Harlan, great to have you.
Thanks, Bill. It's really a pleasure to be here.
Really enjoyed your backgrounds today about the future of medicine, but particularly as it relates to data, outcome, and how to engage all what is really going on in technology and everything that's available. What do you think are the big challenges? And I see, at least for myself, the challenges of some of these data being overwhelming when a physician is trying to take care of a patient. We've been gradually overwhelmed with electronic health records, etc. How can we facilitate this? Because you brought in great concepts of how to get all these data together. I know you're working on it, and some of the challenges that you're facing, and hopefully trying to facilitate this patient-physician engagement while you have all these data behind you.
Yeah, I think we're on the cusp of really large-scale change and potential transformation of the way in which medicine operates. We've become an information science. And I talked today about the data, how we're going to be able to aggregate and organize the data, and what that can do for us. I talked a lot about the analytics and the increasing capabilities, both on the mathematics as well as on the computational science side, what we're able to achieve. And I talked about the communication of the data, the way in which it's transmitted, organized, and presented. And then I emphasized the need for us to maintain our course on patient-centeredness, to put people in the middle, to not lose the humanity in medicine in this. And I think the part that you're mentioning right now about how do we handle this? So much is being generated, whether it's studies, data, all the stuff coming at us all the time. And I think it's because there's been a neglect about the user interface, is what the technologists would say about software, the presentation, the ability for us to leverage it and understand it quickly. So it's one thing to be able to accomplish pulling the data together and doing sophisticated analyses, but it's a whole other thing to be able to say at the point of care on a busy day, when you've got to be taking in a lot of information from a lot of different places, how is it being visualized? How is it being presented in a way that it can be quickly understood and then incorporated into discussions and decision making? And this is as important a part of the entire portfolio of work that needs to be done as anything else, because if we do a great job pulling together data and with the analytics, but we fail in the communication and transmission, the integration into practice.
It can be overwhelming. There's no question about it. And the other, I mean, I'm attending on the service this month, and I know you do. So you're not just looking at, things. You're still are involved in patient care, and we feel rushed, too rushed, be it in the hospital or in the outpatient setting, to be able to do that, to try to keep the same time that we interact with patients, like in the older days where you just scribble a few things here and there. And now I think the data can be overwhelming. So in our healthcare system, if we really want to do well, we have to accommodate for more time with the patient, at least for us to be able to handle this whole situation.
I completely agree with you.
I think, if the ultimate goal is good outcome of patients, but the paradigm is shifting to make it even much more patient-centric and data-driven from patients, I don't think we can operate with the same efficiency necessarily that we had before. Maybe your time with the patients is going to take a little longer for you to be able to provide this good care.
Well, I think first of all we have to articulate our clear values. We need time to be able to interact with patients, not interact with keyboards. And the electronic health record was built in a way that didn't promote our performance. Can I say bigger understatement than that? It degrades our performance. It degrades our performance in wasting our time. It degrades our performance in focusing our attention away from the individual that we're trying to provide care for. I think it's about us reimagining and re-engineering the way in which the workflow goes and the way in which information is presented. I don't think that this will necessarily entail more time. It's a question of whether or not we've been smart about the dashboards we create. When I go in and see a patient, what's essential? How do I visualize quickly what's going on? Right now I've got to go to the HR. I'm pulling data from different
Different
places. I mean, understanding what's new, what's happened in the interim. I mean, I've got no timeline, so I'm kind of trying to piece it together in my own mind. Honestly, I should have a scrap of paper over here where I'm writing it down so I can see it in a way. I mean, we are being put in a position where we have to do extra work, extra thinking. It's extra cognitive load just to be able to pull this together. Whereas we have the tools, the computers, the systems exist for us to say, what would be a smart dashboard? So when
this smart dashboard is so important because with electronic health record, you could see actually overloading, since this is easy to get, overloading the information so that actually you become at times less efficient. And so we really have to be smart and making it much more efficient, available, probably easy to get to at the same time.
So the analytics can occur under the hood. They're not necessarily have to be in view. What percolates up to us needs to be actionable, clear information. We should always be able to go a level or two below, depending on what we're interested in. But we should be able to quickly walk in and see the pertinent information quickly. And we should be able to know what's been done when and what's transpired since we were last there. And, you know, I don't know if you're in this situation, but whether it's the notes, I mean, I can get the lab sheet up and sort of see the flow, but then I've got to go to the notes. A lot of the notes are being repasted. So trying to figure out what exactly here represents someone's new thinking, interpretation. I mean, all these things it's cognitive load. And I don't think we're thinking properly about how do we put you in a position. I mean, if we did this to pilots, I mean, everyone would be grounded because they would say, I just can't do this. And instead what we do is we put on autopilot things that can be autopilot. For us, same thing. There's some things that can be automated. And then for the things that are critically important, you need to be there for. What do I need to see? People have told me even this on metrics. You know, we have too many metrics. Well, maybe we have the wrong metrics, but you know, I think there's a lot of things in medicine we need to be looking at. But the question is, how do they handle this on a plane? They don't say that you can only have 5 metrics. They may have 40,000 things being measured, but
somebody has to simplify, and somebody has to really
think about the user interface. How is information transmitted? What's actionable? How do we improve the workflow? And that way we can concentrate on the human relationships with our patients. We can acquire, process the information that's coming to us in a way that decreases the cognitive load, makes sense. And, you know, I gave an example of, you know, what the Weather Channel does, or what, you know, these programs that are looking at traffic patterns do, you know, that, and I said, you know, no one ever taught a course how to interpret these diagrams. They were built to be intuitive. And yet they have high dimensional data within them. They have a time dimension to them. You can look at them and within 3 seconds, you understand a lot of information. Where have we done that in medicine where I can quickly look? And again, this doesn't say I have to be a superficial level, but just, I'm about to enter the room, what's going on? And why should that take me 20 minutes with 100 clicks in order to figure that out? And again, you know, this is about us being wise about this. And this is just one facet of it. Like I said, the data itself, the analytics, what questions we're asking. I also made the point that sometimes we're predicting things that are obvious. And again, this becomes a cognitive load too. It's a waste of our time. I mean, I don't know about you, but when some analytic program tells me something, this patient's sick, and I look at them and they're in Trendelenburg and the blood pressure is 60, I feel insulted. Like, yeah, I get that. This patient's sick, right? I don't need a program saying, you know, red alert. You know, I'm looking at the patient. And so where is it giving us incremental information that's helping us as opposed to telling us things that we already know and really just contributing to noise?
The other thing that I think, you know, we're a bit involved in that, and you mentioned, which is harnessing the data to try to predict risk better. And also, there's a time domain to that things can change. And I'll take an example and see what you think. An echocardiogram. I mean, in it, there's ventricular function, atrial size. All these are important determinants, right? Diastolic function, hypertrophy, the clinical history, so many other things. And gradually, I mean, it's hard for an individual to kind of put it together. But I think with these data available, particularly that there are discrete data, can be put together for that particular individual, your risk is incredibly low because all these parameters are normal, if you will, as opposed to somebody else who has 1 or 2 or 3. I mean, this is where artificial intelligence and things can come to play. I think, what's your thought about that?
Yeah, and what I contend is that we've been entirely reductionist in our approach. In order to make our calculations easy, we've taken rich data and we've compressed it into sort of very simple data. We lose a lot of information. There was a term that Alvin Feinstein used, the sort of great clinical epidemiologist at Yale, called oximetry, which was it was about understanding the change in variables over time. So it's not just looking. Not just looking at what your PSA is, but what's the trajectory of it. But it's not just PSA. It's all of the things. What's your ejection fraction? What are your parameters on the echo? I mean, how do we understand them, and how do we understand these high-dimensional characteristics? That is, it's not just a singular variable, but how this is moving in concert with this and with this. And what does it mean? And the degree to which we basically just say, yes, no, your left atrial size is this, and that means this, without understanding what's the dynamic nature of this. Has it been stable for a long time? Is it? Now, we intuitively do this as doctors. Are these new symptoms or old symptoms? Or, but the degree to which we can start being wiser, being able to channel master clinician intuition in a way that is spread and that we can all partake of because we're learning together. The other thing is that we've largely sequestered knowledge. I may have a large amount of clinical experience, but it stays with me. I can try to teach you, but I'm doing it one-on-one. If we can start to channel this, then clinical experience becomes a reservoir of knowledge that can be spread and scaled in ways that are useful. But again, it all depends on us being able to get the data we need in order to learn in rapid fashion.
And the last one, I know you didn't have probably time to address it, is yes, we're looking at this patient-physician relationship and improving it. How can we engage patients better? Data tells us now that even Fitbits or various instruments can last for a short period of time, and then the effect is lost. The conversation has to be is in a partnership, and what I see at times is lack of motivation towards health. Although you may have the data in front of you, you may have the knowledge, but not necessarily the motivation to work towards that knowledge to improve health. Some thoughts from your end with all these technologies and other things. How can we engage them better?
Yeah, I think it starts with culture. The question is, do people feel respected, and do they get a message from us that we want them as participants in their care and health? I think we give a lot of implicit messages like we're a little busy and we're trying to transact quickly, and people get the message that it's not a conversation, a two-way conversation often. I mean, just to be honest, and there are pressures on the healthcare system to kind of move people along. And so how do you convey a sense of interest in them? I'm a big proponent, how do we give them access and agency over their data? How do we show a tolerance for decisions that might not be the ones we would make, but that depending on what their values and preferences are, they might make? Where do we become coaches where we say, I just want to be honest, you just made a choice that I might make differently, but let's revisit it when you're ready. Our lecturing them when they're not ready to move, it leads to an inevitable same result of nothing changing. And look, we have to acknowledge that people in their lives are making different choices. For some people, short-term behaviors are gratifying in a way because of the way their lives configured. They're not ready, don't have the reserve, don't have the ability to focus on things. And what I need to do in my interactions is to make sure if you persist in this behavior, it puts you at higher risk. You may not be ready at this moment because you've got a lot of other worries, your rent, your kids, your job, whatever it is that's weighing on you, that's taking a lot of your cognitive attention.
At some point in time, hopefully it will.
So when, because some of this will take willpower to break habits. At the same time, we want to facilitate, here's ways to make it easier, right? Join groups or, make a bet, so loss aversion. So like if you don't quit smoking, you have to give money to charity that you don't like. I mean, there are these kind of tricks that people use, but ultimately people have to be ready for them. And again, some people are not in a position in their life to do that. And so rather than scold them, I think we have to understand them. And we want to make sure that they're cognizant, but in many cases they are. And we want to say, we're ready to help you when you're ready. And maybe you'll be ready in 3 months. So maybe let's make an appointment to talk in 3 months. What would it take to get you ready? As opposed to say, you got to stop, you got to lose weight, you got to get something, you start giving them a long list. And honestly, there's a lot more on their mind that day that may be more urgent even to them. And so what I found successful is let's pick a date in the future when you think you might be ready. What would it take to kind of settle your mind? So just think about now that future. The other thing is, what would your future self say to your present self? And think about yourself in that position. And are there things that you wish you would have done today that you don't want to regret that you didn't do? But again, some of these are just, but if someone says, Doc, I just can't do this, I think rather than express disgust or disapproval.
Conceivably also the ways of communications are changing too, so it doesn't have to be always a face-to-face situation, but there are many ways nowadays that we could engage them.
But knowing that we're not disapproving of it, but that we recognize that behavior change is probably one of the most difficult things any of us will ever do. We all have habits that we know are difficult to break, that we may think in a perfect world we would break them. But yeah, I mean, I think connecting in that way is the real mechanism of engagement. And then there's other things, like I've said, around data, technology, finding ways to connect with them outside, so we're not just seeing them in this way, you know.
Harlan, it's great to have you.
Such a pleasure to be here. What a great place you've got. I'm so happy to be here. And
wonderful to be able to chat, and I'll invite you to take a look at that ground rounds. It really is very inspiring, futuristic, and it's not too far away. Thanks.
Thank you.